I'm Dr. Ken Sowinski, Randolph County Health Officer, and I'm here to talk about COVID-19. Our first question is, what is it? COVID-19 is caused by a new coronavirus. Coronavirus is a family of viruses that have caused infections in humans that is a part of our seasonal cold and flu season. However, this particular virus that's causing infection right now is new. It was not seen before December of 2019. It emerged in Wuhan, China, at a market where there was animals. At that market, the virus that normally infected animals jumped over and started to infect human beings. Over the course of time, this virus has changed and now can infect humans easily. That's why we're seeing it have such a dramatic impact on the entire globe right now. How do we catch COVID-19? It's typically transmitted through respiratory droplets. What that means is if you cough or you sneeze, you put that virus in the air through droplets. But it can also be transmitted through talking or through laughing. When that droplet hits a new person, the virus can then infect them. And why is this so serious? The reason is because this virus is new. What that means is over the entire globe, there's not a single person who has immunity against it. That means that everybody is vulnerable to catching it. When we get a cold or we get the flu, our body develops antibodies against it, which makes us immune to it. So that if that same flu or cold virus hits us again, our body can fight it off before it makes us sick. This new virus, because nobody's got immunity to it, is capable of infecting everybody. When it's capable like that, depending on how easy it is to spread, then that makes this virus capable of infecting large numbers of people. And that's exactly what we're seeing right now. Some may be asking, this has been a big deal in the news, but when I look around, I don't know anybody who's got it. So why is everybody so excited about it? The reason is because there is a lag between when we see a case reported in the news and when those people that are being reported actually got infected. You see, people that are having a positive test today, they were actually being exposed to that virus 14, 18 days ago. And so the numbers that we see today are really reflecting what was going on 2 weeks ago. Just this morning, when I looked at current numbers, globally, we surpassed 1 million cases. In the United States, we have about 245,000 cases. In Randolph County, we now have 5 cases with 1 death, 2 people still in the hospital, 1 critically ill on a ventilator. On March 19th, exactly 2 weeks earlier, the number of global confirmed cases was the same as just what we see in the United States today. There's almost a 20-fold increase in United States cases just in 14 days. And so what was going on 14 days ago is only being reflected in the numbers today. Why is this serious? Because if there was a 20-fold increase in the last 14 days, and those numbers today reflect what was going on 2 weeks ago, what does that mean for the next 2 weeks? That's why it's important to take this seriously now. So what are we doing about it? Well, first of all, you're well aware the schools have been closed, businesses have been closed that were deemed non-essential. The governor of Indiana has delivered executive orders regarding stay at home. And you've been hearing all about social distancing. Every one of these maneuvers is designed to keep people away from each other. Since the virus is spread primarily through respiratory droplets, it is close contact that allows the virus to spread. The 6-foot social distancing rule is because when we're within 6 feet, that's how far these respiratory droplets can go to land on somebody else and cause infection. When we stay further than 6 feet apart, then that virus has much less opportunity to spread from one person to the next. Social distancing, isolating ourselves from one another, is the way that we stop the spread of this disease. Recently, there has been limitations in the number of people that we recommend going into any store at any one time. And I want to explain that a little bit. Our local grocery stores are open for obvious reasons. We need to get groceries, we need to get supplies, and we understand that well. But when we are having a stay-at-home order and we're allowed to go to the grocery store, that has become a busy place. And the busier it gets, the more interactions that occur, the greater the likelihood of COVID-19 spreading in those places. So it is incumbent upon us to make sure that when we are going shopping, that we send one person to do the shopping, not bring the whole family. The more people that are together, the more crowded a building is, the greater the likelihood that the spread of the virus is ongoing. So, what should I do? Well, the reality is that we all need to do our own part in slowing down the spread of COVID-19. What we do as an individual affects everybody around us. And infectious diseases are a community problem, and they require a community approach. The first step of what you can do is to honor social distancing. Stay no closer than 6 feet apart from other people. Avoid gatherings. Stay at home. When you need to go shopping, send just one person. These are the types of things that will reduce the more vulnerable populations from getting COVID-19 and will help to protect you as well. You want to make sure that you're paying attention to adequate hand washing, using hand sanitizer whenever you touch your face or touch objects around you, such as doorknobs and handles. The guidance that I give people is wash and sanitize when you arrive at a place. If you go to the store, sanitize on the way in, sanitize on the way out. That way you're protecting yourself against anything that you've touched inside the store. Other questions about how can I be a good community member? How can I help? Well, first of all, if you're going grocery shopping, just buy what you need. Number 2, stay at home. Number 3, adopt a neighbor. We all know people that are vulnerable. People more vulnerable to being harmed by COVID-19 include those over 60 and those with chronic health problems, things like heart disease or lung or breathing problems, kidney disease, diabetes. And if you know people that have chronic illnesses or are over the age of 60, call them up. Pick 2 or 3 neighbors and check in on them every day by phone. Find out if they have any needs. Are they running out of toilet paper? Do they need some groceries from the store? Do they need supplies? And since they're vulnerable, offer to go shopping for them. Then, when you do that shopping, you drop it off at their door, you knock on their door, and you step away from that door so that you're not anywhere around them. Let them get their groceries, and in so doing, you have prevented them from exposing themselves to harm from this virus. Other things is that blood donations are way down, and there's a critical shortage. Keep track of the Red Cross and blood donations, and go out and donate blood. I want to next answer some frequently asked questions about COVID-19, for which there's a whole lot of misinformation. Number one is, what about my pets? There have been no cases of transmission of COVID-19 through pets. You do not need to socially distance from your animals, and you can continue to take care of them. Number two, what about my food from the grocery store or from carryout? Is it safe? And the answer is yes. There are no reported cases of transmission of COVID-19 through food. What exactly is social distancing? Social distancing means stay 6 feet apart and don't gather in crowds. Especially to our youth, I would encourage you not to get together to play basketball. It is necessary in playing basketball that people interact, jostle when they compete. You are also handling the same ball. So COVID-19 can spread through activities like this. But that doesn't mean that you can't go for a walk or a run in the park. Ride your bike. Just make sure that you're honoring the 6-foot distance. That's how you stop the spread. That's how you safely exercise. What does it mean to have a stay-at-home order? Stay-at-home means that you stay at home if you have no essential travel or business. If you have to go to the grocery store to get your groceries, that's okay. Again, just send one person, not the whole family, to get out of the house. Also, your home includes your yard or your front porch. So it is appropriate and okay to go outside. Also, our Indiana governor has made it clear that it is appropriate to go for a walk, to ride your bike outside of your home, and that as long as you're keeping a 6-foot distance, that is a healthy, good activity to do. What about kids visiting grandma? Well, it does go against the spirit of stay at home to have a visitation with grandparents in another home. It is not appropriate to hunker down with the grandkids going back and forth between their nuclear home and their grandparent home. Now, some grandparents are taking care of their kids because it's essential child care. Mom and dad work, and they have to work because they work for an essential business, and grandma and grandpa are taking care of the kids. That is an appropriate situation for a kid to go back and forth because the business is essential and the child care is essential. However, it is not appropriate to visit for the sake of a visitation. That puts those grandparents at greater risk for contracting COVID-19. What about visiting friends? Again, we should not be traveling to visit friends, even if it's just across the street to our neighbor's house. If we have business with our neighbor that includes getting them groceries, put it on their doorstep, knock on the door, and step away. But we shouldn't be going over inside of their home to visit. Where can I get reliable information? If you want to keep track of the numbers, one of the best sites is Johns Hopkins University with the URL below. Also, the Indiana State Department of Health is a reliable source of information. The Centers for Disease Control, and locally, you can get information from Mayor Chad Spence's blog. We would welcome your input on what you want to hear about coronavirus and any questions. I want to reiterate that information changes every day. Recommendations change every day. And so I encourage you to stay up to date with reliable information so that you can keep yourself and your family protected. Thank you very much.
Well, we certainly appreciate Dr. Sowinski's comments. It's so important during this time to know the facts and to know that as a member of this community, you play a role in helping us fight this battle. If you want to be a hero, you can be a hero. Do your part. Each and every one of you watching this has a part to play in this, and it's so important. We can and we will get through this, but we will get through this together, and we are in this together. Thank you so much. God bless.